My name is Evan Chance, and my presentation is on substance use disorder and addressing it as a public health priority. Substance use disorder, or SUDs, occur when the repeated use of alcohol or other drugs cause significant impairment in a person's health, relationships, and ability to meet responsibilities at work, school, or at home. One of the most pressing issues surrounding substance use disorder is the limited access to treatment. Millions of people struggle with this condition, yet only a small percentage are able to receive the help that they need. In 2018, only 11.1% of people with substance use disorders received treatment, and in 2019, this increased slightly to 12.2%. While that's significant progress, it's far from enough. Healthy People 2030, a project of the U.S. Department of Health and Human Services, has set an ambitious but vital target to increase this number to 14% by 2030. However, reaching this goal requires all of us to spread awareness and support initiatives that make recovery accessible for everyone. Let's work together to close the treatment gap. Substance use disorders don't just happen. They're often influenced by a combination of risk factors. Mental health challenges, genetic predisposition, environmental influences, and early substance use all play a significant role. By identifying these risk factors early, we can focus on prevention and intervention, which are key to reducing the prevalence of substance use disorder and helping individuals before their condition worsens. Prevention starts with small, meaningful steps that anyone can take. Building strong and supportive relationships can act as a protective factor. Managing stress effectively can reduce the likelihood of turning to substances as a coping mechanism. It's also important to seek support when needed and to stay informed about the risks of substance use. Together, these actions can significantly lower the chances of developing a substance use disorder. Everyone has the power to make a difference in addressing substance use disorder. Use your voice to advocate for better access to treatment and resources. Contact your local representatives and urge them to increase funding for treatment programs. Support local organizations working to combat substance abuse. And most importantly, educate yourself and others to help reduce stigma and spread awareness. Small actions can lead to big change. If you or someone you know is struggling with substance use disorder, there are reputable resources that can help. The Substance Abuse and Mental Health Services Administration provides a 24/7 helpline for treatment referrals and information. The National Institute on Drug Abuse offers comprehensive research and resources on addiction and recovery. Alcoholics Anonymous and Narcotics Anonymous provide peer support through free meetings in local communities and online. These organizations are incredible starting points for anyone seeking help or information. In closing, let's remember the key points. Limited access to treatment remains a major barrier, with only 12.2% of people receiving the help that they need to recover. Healthy People 2030 aims to change that by increasing treatment access to 14%. Understanding risk factors like mental health, genetics, and early substance use allows us to focus on prevention and early intervention. Prevention starts with small steps, building relationships, managing stress, and staying informed. Advocacy is essential. By reducing stigma and pushing for greater access to treatment, we can create a brighter future for those affected by substance use disorder. Together, we can make recovery possible for all. Thank you for watching and joining me in the effort to address this critical public health issue.